10 minutes to 8. This is CBC Radio One on the island. Well, if you've tried to find a family physician in recent years, you know it's probably a difficult thing to do. There's a serious shortage of doctors in many island communities and, in fact, across the country. Millions of Canadians do not have a regular family physician. Now, the BC government has announced a program to give everybody who wants a family doctor the ability to access one by 2015. One new innovation will be essentially a dial-a-doc program. The program builds on several pilot programs that have been running in BC for the past few years. One of those pilot projects is in the Cowichan Valley. Dr. Tom Zimmer is part of the project. He's based in Duncan, and he's on the line to tell us more about it. Dr. Zimmer, good morning to you.
Good morning, Gregory. It's actually Tom Rimmer. Nice to meet you.
Pardon me, Dr. Nimmer. Nice to meet you as well. Now, how many Cowichan area residents did not have a physician when this pilot project started?
Well, our pilot project started about 2 years ago, just over 2 years ago, and we were one of 3 prototype communities, ourselves, White Rock, South Surrey, and Prince George, tasked with doing the attachment work. One of the things that we did at the very beginning was to try and identify what our attachment issues were. And so we commissioned a study of our area and learned that we have probably in the neighborhood of 4,000 truly unattached patients. But we also learned that we have a significant number of patients who are poorly attached or weakly attached to their family doctors. And I guess what that means is that although if they turned up at the emergency room and were asked if they had a family doctor, they would say yes, but looking back, they received a good portion of their care from either the emergency room or walk-in clinics and not their actual family doc.
Did the project identify the reasons why residents perhaps didn't have an attachment to a family doctor?
There are a number of reasons. Speaking to the 4,000 number, a good number of those people fall into the category of difficult to attach. So sometimes there's issues around mental health or substance abuse, and they don't really fit with the usual model of making an appointment with a family doc and keeping it. So those people are often difficult to attach, and they're certainly one of the focus groups of our attachment work.
And maybe it's obvious, Dr. Rimmer, but why is it important that people have attachment to one primary physician, especially if they have a chronic illness?
Well, there was a large study done by Hollander in 2009 which showed that for patients with one or two or more chronic diseases, if they were attached to a family physician, a regular care provider who knew their story, knew their family, and knew what their issues were, they cost the system a significantly lower amount than those who weren't attached to a family doc. Mm-hmm. There were fewer emergency room presentations, fewer hospital admissions, and people just seem to do better.
All right, so they're doing better for their own health, and that's costing the system less money.
Mm-hmm.
So now, what about the practicalities of this? How did the project go about connecting these people with physicians?
Well, one of the things that we learned in our attachment work is that each community has its own unique set of issues. For us, we found that there were a number of people who fell into the difficult to attach patient group. So one of the things that we did was try to come up with some creative ways to attach that group. But the way we tackled attachments in general was kind of a multi-pronged approach. We've attached a goodly number through our Cowichan Valley Maternity Clinic, so pregnant moms and babies who came to our service without a family doctor left attached to a family doctor, and they took their families. The physicians who attached these people also took on the families associated with these folks. We also have a program called the Hospital Support Program, where if people are admitted to our hospital and they don't have a family doctor locally, or if their family doctor doesn't look after hospital patients, local doctors will do that, and quite a few patients were attached through that program too.
What results has the project seen in the numbers of patients with family doctors? Has it been a demonstrated improvement?
Yeah, we've certainly seen some pretty good results. The numbers that I'm giving you this morning are a rough estimate and not quite up to date, but As of our last count, we'd attached over 1,300 patients to a family doctor in our area.
And does this end up costing the system more immediately? And I appreciate what you say, that over time studies have shown that you'll get improved health benefits, and that should save the system. But does it necessitate spending more on GPs or administration or something in the shorter term to get people attached to family doctors in the first place?
I don't think so, Gregor. Most of the funds supporting this attachment work are basically reallocated from existing programs. So it's just kind of a shifting of priorities and resources to get the work done.
So do you think, Dr. Rimmer, this will benefit particularly smaller communities where there's a shortage of family doctors, or I mean, is there only so much you can do if essentially you don't have enough doctors? Well,
that's certainly one of the issues that we've faced here in the Cowichan Valley. In the Lake Cowichan area, they're down to, as of September, they'll be down to just one family doc. So a big part of our work is trying to get creative about A, recruitment, and B, what to do in those situations. And one of the things that we're doing in the Lake Cowichan area is we've struck a recruitment committee with the local town council and chamber of commerce, and we're working to attract new people there, realizing that when you attract or try to attract or recruit a physician, you don't need to just target the physician, but you also need to think about the physician's family. So you need to be able to kind of show off what schools you have and what the community has to offer to not just the physician but to their family. So we're working on that. We're also looking at piloting a program involving a nurse practitioner doing some of the primary care to take a little bit of the workload off the existing physician out there.
And we've been hearing that's been tried in other remote communities. Have you got a sense from elsewhere how well the nurse practitioner model is working?
I think in other areas it seems to be working quite well. It's new to us, so we're kind of making things up as we go along. But we're quite excited that it's an opportunity to do some of that work locally.
Well, Dr. Rimmer, it's good to hear from you this morning. Thanks very much for joining us. Appreciate this.
My pleasure.
Dr. Tom Rimmer is a family physician based in Duncan. It's 3 minutes to 8 o'clock now on this Monday morning. This is CBC Radio One on the island. And Jennifer Krumka joins us from the newsroom with the local headlines.